As Americans navigate life amid this pandemic, questions remain regarding the future of healthcare, small businesses, and the economy. One America's Jenn Pellegrino has more from Washington.
Rick Manning, president of Americans for Limited Government, thanks so much for joining me today. Rick, I want to get started and ask you a little bit. The last time you came into the studio, we talked about surprise medical billing. How does that relate right now as the nation is going through this coronavirus pandemic?
Well, the President of the United States made certain that it should have been taken off the table because he said that there won't be any charges for coronavirus testing and there won't be any charges for treatments. They will be covered. Nobody will be out of network, and so people don't have to worry about that. However, during the Senate negotiation, there was a big push by Senator Alexander and others to include a national input that make this permanent in terms of creating a national one-size-fits-all rate-setting program. Unfortunately, the Congress resisted that. The Senate resisted that. Majority Leader McConnell resisted that. And as a result, this bill doesn't lay the framework for one-size-fits-all pricing, which is an essential component to socialized medicine.
Rick, can you talk a little bit about how this affects small businesses right now?
Yeah, the small businesses, there's 30 million of them across the country, and they're the backbone of our economy. More people are employed by small and mid-sized businesses than by these gigantic businesses, the multinationals. And so that's where we get our employment bumps from. When we see people unemployed or employed, it's generally small business that's you can see it from. Right now, what we're seeing is small businesses across the country don't know how to can't survive for 2 to 3 weeks more of a shutdown. Literally, I've got over 100 in 2 days. I got over 100 videos from small business owners telling me specifically what situation they were in. Some of them literally breaking into tears because their businesses, their health clinics that they're running, those kind of things, were going to go under because they couldn't afford to pay salaries, they couldn't afford to pay rents, they couldn't afford to meet the basic costs, and there were no customers. So they're servicing the health center. I'm thinking about is servicing people. They're taking phone calls. They're taking phone calls from scared people, but people are scared to even go in their waiting room. And so the waiting rooms are empty. There's no revenues coming in. And these businesses are not built where you can live for weeks and months on time with no revenues. They're a lot like your household. You got no money coming in. You've got big problems and you have to cut everything. And that means higher unemployment and a disaster. Quite honestly, it's almost impossible, Jen, to restart this economy if we destroy the backbone of the country, which is small business.
I mean, the president has said, they ideally would like to get the economy back up and running by Easter. What are your thoughts?
Well, I'm hoping we can get it done even sooner than that. Well, New York City has a tremendous problem, but Rochester, New York might not. So to treat Rochester, New York the same as New York City doesn't make any sense. Fortunately, we have a federalism form of government. The president doesn't make these decisions. He can provide guidelines, and that's what they're doing in terms of looking at things on a county-by-county basis. So you can have different approaches to mitigate the disease for different jurisdictions, and that will allow small businesses to thrive in 90% of America.
So where do we go from here, Rick?
First of all, everybody needs to be safe. Everybody needs to do what you feel is necessary for yourself and your family. So in those hotspot areas, we'll have those needs made. But we ultimately have to also be able to, in those areas where they aren't hotspots, have businesses be open and thriving. And quite honestly, we have to limit transportation from hotspot areas to elsewhere around the country. So I think we just have to be smart and not take a one-size-fits-all solution. That's what local governors are going to have to do, and mayors. Does this apply to us? And if not, then we need to make certain we are destroying our local businesses in the process of trying to deal with a problem that's in Seattle or New York City.
That's true, and that social distancing, I think, will continue on for some time as we navigate through this.
That's why the masks are so important, and getting mass production of masks, because if people feel comfortable and they're wearing their masks, at that point they'll feel a lot more comfortable going out and resuming life somewhat as normal.
Rick Manning, thanks so much for joining me.
Absolutely. Thank you very much, Jen. You have a great time also. Enjoy what people are calling a staycation, although I'm working my tail off. So I don't know where that comes from. Take care.
No rest for the media.
No.
Thank you, Rick.
Bye.
Want to see more videos like this? Click on the link below and subscribe to One America News on YouTube, and call your cable provider and kindly demand that One America News is added to your lineup. Call and subscribe today.